Kenya is pleased to join you today for this dialogue intended to foster partnerships to support African member states' implementation of COP26.
We have seen over the last years mounting scientific alarm about the status of climate change trends. Unless we develop resilience and new solutions in the provision of primary health and community health care in Africa, we are going to suffer serious economic and social repercussions along the way.
We want to see what the governments can do, but we want to see what the partners can support the governments to do. So this is going to be an event that needs to really take in both angles of things.
Ces changements climatiques peuvent toucher le système de santé à travers plusieurs niveaux, les maladies non transmissibles, les maladies transmissibles à cause d'une mauvaise nutrition, parce que tout simplement, ces perturbations peuvent amener de grands désagréments au niveau des changements de comportement, mais également des écosystèmes des vecteurs.
I think since we had the first case of cholera in 1973, we will be having all these years maybe 1 or 2 cases, but not of this magnitude.
Le problème des changements climatiques est bien ressenti au Togo, sans oublier bien évidemment la pollution de l'air. Et les conséquences sanitaires sont directes, choléra par-ci, méningite cérébro-spinale par-là, avec toujours des difficultés de prédiction.
The next thing to think about is that the climate crisis, as we've had, it is here. And I think you've heard the ministers very, very clearly. And for this particular conversation, it is time for action on mitigation. So, what is your role in actually supporting the challenges you had here with the ministers to move forward?
As foundations, we need guidance from the leadership, both at the country level as well as the technocratic level. Not only that, we feel that we are stewards of driving equity. So a broad coalition of voices from a broad coalition is what is needed. With this specific topic, the challenge that we have is trying to understand and articulate a common vision. What is the single agenda here that can really galvanize energy across all of these sectors?
So as a predominantly research funder, what we want to do is work with countries to help understand where you feel there are evidence gaps and build the evidence to help make the case. I know that there's some anxiety amongst the health community that the sort of gaining momentum around climate is taking or will take money out of health. And I just want to say that I think they might be right, but actually I don't think that's something we need to be anxious about, because the most effective health-sensitive climate actions can make a tremendous difference to health.
Many of you may have heard me say this time and again, that it is a big way of changing how we do business in the bank. We've committed ourselves to increasing our share of financing to 35% by fiscal year 2025 that would go towards climate action, both adaptation and mitigation. Now, this to us sounded also not enough. We pushed it up to 70% by fiscal year 30. So 70% of what the World Bank is going to be financing across sectors will be towards climate action.
So it's up to us now to converge on this call to action so that we can close the gap. Thank you for being here, and I hope all of you prepare for COP28, and I hope as many of you are planning to come to Nairobi for the Africa Climate Action Summit in September.